Have you been injured, had some sort of exam, maybe even some imaging, and told everything looks normal? Do you still hurt and not know what to do next? Don't worry, you're not alone. A common injury that is missed with spine injuries is ligament damage. And this is part 2 of a 4-part series. Hi, I'm Dr. Matthew Collins. I'm a chiropractor and board certified in rehabilitation. I'm fellowship trained in primary spine care. In addition to my education, training, and experience, I've been managing patients with ligament injuries to their spines for decades. Please note, these videos are not a substitute for professional medical or chiropractic advice, for diagnosis, or for treatment. These videos are for informational and instructional purposes only. Now, seeing the wrong doctor after a spine injury can result in an incomplete diagnosis, wrong treatment, and then even persistent pain and poor to no recovery following injury. This 4-part series, we already had one where we talked about what a normal ligament is and what its role and properties are. In this video, we're going to discuss what the injury actually looks like. Part 3, we're going to discuss the role of chiropractic management with ligament injuries. And then in part 4, we're going to discuss what you can expect in terms of recovery. It's called prognosis. Now, moving into ligament injuries. Ligaments are injured and then damaged, and they're given different grades. You can go to the American Academy of Orthopedic Surgeons and find the grades listed out. It's grade 1, grade 2, and grade 3. Basically, it's mild, moderate, and severe. Now, grade 1 is where the ligaments are injured. There's some fibers that are torn, there's pain, there's inflammation, but you're not going to see anything on imaging. The imaging is going to look normal, but the physical exam and the symptoms are consistent with that of a sprain. Grade 2 is where there's partial thickness tearing of the ligament. This is where there is some rupture of the fibers and the ligament is deformed. These joints will struggle to have weight put on them. It's difficult to what's called weight bear. And if there's a feeling or a sense of the joint giving way. On imaging, we can sometimes see the tearing. Sometimes we can't. Other times we can sometimes see the joints that widen. So a ligament, which is straps to hold bones together, if that strap is stretched and doesn't go back to its original shape, that joint can, under load or under pressure, can slide apart and you can have joint space widening. And then grade 3, this is full thickness tearing. This is where there's a complete rupture of the joint. A lot of times in the spine, these full thickness tears can be catastrophic. So we don't see them typically in a chiropractic clinic, but that is the grades that are out there. Oftentimes a full thickness tear can lead to some sort of surgical stabilization. Well, how does this happen? How do ligaments tear? Well, the reality is that ligaments have several different properties, and one of them is called a viscoelastic property. So ligaments tear when the pressure exceeds or the strain exceeds the ability of the ligament to withstand the force that's delivered to it. Now, I've got a child's toy here that explains some of the different properties, and it's called silly putty. So if you think about when we were children, if you take silly putty, all right, this is a viscoelastic property. This is not a ligament, all right? If you take it and you pull it slowly, it can stretch and deform. However, any of you that have ever played with silly putty also know that if you take the silly putty and you take it to the same length, but if you do it rather quickly, it'll break. So a lot of times with ligament injuries, it's not the speed that harms the ligament, it's the sudden stop, or alternatively, it's the sudden jerk. So ligaments that don't have time to react, they can tear. But ligaments that are able to have time to either get warmed up or can go along with the range of motion, they don't tear. And that's how a lot of these injuries can occur, whether it's in a sporting accident or whether it's in a motor vehicle crash or a sudden fall. So as it's been said, it's not the speed that kills you, it's the sudden stop. And that's what it comes down to with ligaments. It's the suddenness, the inability to respond. That's how tissues tear and get damaged. So to wrap this up, most people that have some sort of ligament injury to their spine, when they're evaluated by whatever medical provider that sees them, oftentimes it's just assumed if it's not catastrophic, it's automatically assumed to be a grade 1. However, if they're not responding, oftentimes, and they can't weight bear, oftentimes it's a grade 2. And unfortunately, the providers that they might be seeing don't know how to work this up. That's what we do at our clinic, is that we'll do a thorough workup diagnosis and order the appropriate imaging. So if you or anybody you know is struggling after a spine injury, don't know what's going on, don't have a solid explanation in your mind, more than happy to take a look at you and see if there's something that we can do to help you. So thank you for taking time to watch this video. You have a lot of videos to pick from. I'm honored that you chose this one. And until we meet again, have a blessed day.